Hello, and welcome to the Texas System of Care Cultural and Linguistic Competence Podcast. My name is Shannon Moreno, and I'm the CLC, or Cultural and Linguistic Competence Specialist with Texas System of Care. This podcast is devoted towards how to work with specific populations within your local system of care community and ensure that you're providing services that are culturally and linguistically appropriate. This series is focused on working with youth who identify as LGBTQ+ and their families. For a further explanation of CLC terminology, including terms used in this podcast, we recommend checking out the ABCs of CLC webinar series. We continue the conversation with Sarah Kapostasy, Clinical Services Director at Out Youth in Austin, Texas. Going off of what you were saying of, Out Youth may be a little bit of like a radical bubble type of a thing. Some listeners who are listening to this may be saying, well, I don't live in Austin. I don't work at a drop-in center. I'm just my little old individual self who wanted to tune into this podcast and maybe pick up, a couple extra words or two or a couple tips or two. Is there any validity to there may be areas where there just aren't any gay youth or aren't any trans youth? And what would be kind of your message to clinicians who may be thinking, because that's the environment where they are, that this just maybe not be a population to talk about or to explore or to try to, set up things a little bit differently within their agency or all these different things that we're talking about today. Can you speak to that a little bit?
Absolutely. So I think what I would say is first, thank you for tuning in and, being open enough, again, to kind of listen to some thoughts on this particular topic. And then I would also say welcome, like we need you. One thing we're thinking about in considering Out Youth, although we're probably a little further from it, just, from a capacity standpoint, and there's a lot of considerations with this, is we're thinking about expanding into kind of online modalities of therapy because we know the need is out there and it's everywhere and it's real. So we have kiddos who drive to our drop-in center from the Killeen area. We've had kids drive to our drop-in center from San Antonio. I have tons of kids from the suburbs of North Austin that come and see us in Central Austin. We get calls at Out Youth constantly from kiddos in rural areas of Texas. We have a lot of youth report to us that they have online friends who live in Lubbock and live in Lufkin and live in the Valley that reached out to them on social media and are there. They're here, they're queer, they're everywhere. And so I would say, they're around. And, the visibility piece might not be there for very good reason, and it's safety. It can take a lot for, especially an adolescent, but even an adult, who looks around at their environment and knows this might not be a safe space for me to come out with my sexual orientation or my gender identity. And so I think as clinicians, I happen to be a licensed professional counselor, but I was raised by social workers, I like to say. I don't know how else to put that. But all of our codes of ethics really encourage us, I think, bottom line, to create spaces of safety for people to be themselves and to feel like they can reach out for that support. So we can't do it alone. Even just, the clinicians in the community that I know who happen to identify as LGBT, we need our cis and heterosexual therapist allies, because there's a lot more of you than there are of us. I know some fantastic clinicians who don't identify as part of the community, who work with this population incredibly well, and just do an excellent job of meeting their needs and meeting the needs of their families. So I guess that would be what I would say, welcome, please join us. It breaks my heart, and we're getting away from this a little bit at Out Youth, but I get a lot of referrals of kiddos from other clinicians in town who are working with them on like anxiety and depression, let's say, but don't know about this gender identity thing. And listen, I get it. Like, you know, our code of ethics also says, like, if you feel out of your depth with a particular client or population, you know, referral is one option, right? At the same time, I have kids sit on my wait list for 3 months because there's not enough clinicians out there who are, you know, up and willing to learn about how to work with this population. And so, yeah, that would be what I would say. I think access and equity in mental health care is a thing I think about a lot, all the time, not just for this population, but for people of different socioeconomic means in particular. So please join us. At the risk of sounding creepy, like, please come join us. Please.
I was just thinking we might need to edit out that join us. That was a little whispery.
Join us. Yeah. So just would love to, you know, have more clinicians out there doing this work.
Yeah. Mm-hmm. And when we think about in Texas, there's so many regions where we have shortages, mm-hmm. you know, that are very well documented. You know, certainly you're right that sometimes it's not that there's never a time and a place for referring clients away if you just genuinely cannot meet those needs, but particularly in areas where there are just not a lot of folks, period, to refer away to, really taking the time to be self-reflective and, you know, try to get to a point where maybe you don't have to refer youth away from services, because even in an area where I think that there's kind of a reputation in Austin that some folks agree with, some do not, but the reputation is there of having a lot of these resources and having a lot of folks who are competent in working with various populations. As you said, that still puts youth on waiting lists. And in areas where there are significant shortages of mental health professionals, there might not even be a waiting list to be on. It may just be flat out not getting services, or at least not getting services in a way that delve into these really necessary conversations and exploring these pieces. So that's huge. I wanted to bring up, I think throughout this conversation, we have kind of just by implication been including non-binary folks, mm-hmm. But without kind of saying that by name, it would be very easy to listen to this and just think of on the spectrum mm-hmm. of, you know, masculinity and femininity. And when we talk about trans individuals, just thinking of assigned at birth female and transitioning, or assigned at birth male and transitioning. And that's not necessarily everyone's story. That's not everyone's identity. Mm-hmm. Can you speak a little bit about specifically non-binary identities?
Absolutely. I love talking about gender. I talk about it all day. So the way I like to talk about gender is, I mean, I think a lot of us, even if we're trying to get away from binary thinking about gender, it's there. It's really imposed upon us by the culture. And so we often envision gender as a line, right? So between male and female. And yeah, sure, we recognize there's some identities in between, but sometimes it's harder to think about the in-between, right? So what I like to say is, for me, gender is like a circle. And there's a lot of different ways that people experience their gender, express their gender within that circle. So when it comes to folks who identify as non-binary, earlier was talking about an individual who, you know, maybe exploring their gender identity, is asking to be referred to by they, them pronouns, perhaps, is socially transitioning, and then doesn't feel like they necessarily need to move forward with any medical intervention. At the same time, there is definitely trans folks that I've worked with who identify somewhere in the non-binary realm, and do want to move forward with certain medical interventions. So again, everybody's story is really different. And, you know, this is a separate podcast, but we could talk a lot about like diagnosis and, you know, the DSM and, you know, how discussion and diagnoses even around this have changed over time. And, there's still some challenges to gender dysphoria, I think, being in the DSM-5 at all, because I certainly don't see it as a pathology. At the same time, we have that as a diagnosis, so insurance companies can pay for stuff, right? So that's a big piece of it. One thing I will say, though, about the diagnostic criteria in the DSM-5 is that it definitely allows for non-binary expressions of identity, which folks might not realize. But it's really sort of nuanced there in the language. And so I guess I'll share a little bit about a client that I worked with, a young adult, uses still, to my knowledge, they, them pronouns. Came to my office. Like, it was really hard at first to even sort of talk about gender identity. And it actually worked with a previous clinician at our agency, just kind of laying some groundwork, right? Like planting some seeds, but they never really got into it either. And so just clinically, like, allowed a lot of time and space, but would gently bring it up every once in a while, because did mention it was an overall big goal was to talk a little bit more about their gender identity. And so over a long period of time, eventually we went through that process of doing the gender timeline and talking about those prompts in those areas. And they realized they did want to move forward with a little bit of medical intervention in the form of hormones. And I'm trying to remember exactly how they phrased it because it was so beautiful. And it was amazing the amount of self-awareness this client had and the amount of reflection they had done about their identity. So I think the way they phrased it is they wanted to, kind of look like an androgynous girl. That was their goal, right? And that's who they felt themselves to be, like really authentically in their gender. And so it was amazing, and it taught me a lot, right? It taught me a lot about the different ways, again, that people experience their own gender identity, the amount of thoughtfulness that goes into, figuring out what that looks like, and then how to move forward with kind of achieving, matching internally what somebody feels about their gender to what other people perceive and see externally. And definitely saw throughout that relationship, again, it wasn't a straight line and it wasn't straightforward, but definitely some improvements in mental health, some improvements in just kind of overall, young adulting, which can be challenging in and of itself, but moving forward with some stuff in career, moving forward in romantic relationships, friendships, and you just kind of see all these different things blossom in doing this work sometimes. And, I think if I, with that client, would have had a binary conception of gender or would have insisted on using certain pronouns in my letter of support, it would not have benefited that therapeutic relationship. So it's I think really important to honor the identity of non-binary folks. And one thing I fear, especially these days, increasingly, is erasure of non-binary identities and non-binary people, that folks may feel pressure to kind of conform to the binary one way or another. And that would certainly be a shame because, again, non-binary identity are things that people feel are are their authentic selves, and to deny that or to feel like you have to conform to the binary would be unfortunate.
And again, we're talking about, at the end of the day, the health and wellness of our youth and the health and wellness of our family units. That's an incredibly important piece to bring it back. And again, I know that we haven't necessarily explicitly been not including non-binary folks in our conversation, but without calling it out and bringing attention to it, it can be easy because of these social constructs, that most of us certainly have of hearing conversations about trans identities or just all these conversations we've had and not thinking of non-binary individuals. So
right. Yeah, and another thing I would add briefly, and this may be something basic that you've covered in some of your definitional podcasts, but I think it's worth mentioning, is that a couple things. One thing I do also want to mention, intersex folks and those identities often get left out of the conversation. So we had a wonderful speaker from Houston come to our recent conference who's really passionate about intersex visibility and advocating for the rights of intersex folks. So I wanted to certainly mention that. But then also I think sort of the interplay of gender identity and sexual orientation, and again, like not making assumptions, right? So, just to kind of lay it out there, there are infinite kind of combinations of the way people identify with their gender and who they're attracted to, right? So, obviously I have some trans guys that I work with who, romantically, emotionally are attracted to, feminine folks. And I have some folks that aren't. So it's a huge range. And I think in terms of not making assumptions, that's one thing I just wanted to put out there related to kind of gender identity and sexual orientation and the interplay between the two.
That's great. And a lot of that goes to the confusion of these are two very distinct pieces
Correct.
to who a person is type
Yes.
of thing. So sometimes people are confused about, well, why would you transition from your sex assigned at birth to, let's just say that you are a transgender male, and then be attracted to men? Why don't you just like quote unquote stay the way you were? And it's because it's different. It's completely different. Your gender identity, the way that you personally identify, on the binary, off the binary, has absolutely nothing to do with who you are attracted to. And that's a huge misunderstanding. It can get really confusing for folks sometimes.
Yes.
We've been talking a lot about kind of one-on-one interactions amongst clinicians. And we've been talking a lot about, because I think it is hopefully safe to assume that listeners are on board with not, bullying their clients or overtly using slurs or anything like that. So most of our conversation up to this point has been talking about sort of like sins of omission, so to speak, of these ways that on an individual basis, if we ignore, we just don't go there, we just pretend it doesn't exist within our community or within our clientele base, that I can still just do good work by, like we were talking about before, being friendly, making eye contact, just talking about the depression on its own, talking about the anxiety on its own. And we've been having a lot of conversations about, no, it's more than that. We really have responsibility to make sure that youth are solid, that they are receiving affirmation, that they have these legitimate, intimate community connections, that they have space to come to an understanding and a confidence in who they are, and as they transition to adulthood, be strong in who they are and kind of, stand strong within their community, stand strong within the society at large. But then there's also a systemic piece to this as well. And most of our conversation has been about the one-on-one. But then there's also, if we're talking about a clinician who works within a larger mental health agency or is, a piece of this larger system of care network of not only mental health providers, but different systems that our youth may encounter and may interact with, that's a different level. And we can see the same two types of options of either overtly oppressing individuals within this population, but then another side that is often not talked about is just not being there for the population, right? Not giving light to it, not speaking of the existence of this community, not upholding this community type of a thing. So can you touch on that piece on the systemic level, what that means in the specific lives of the youth that you've worked with and the impact that can help that can have on their health and their wellness.
Yeah, absolutely. So I think I'll actually start with an adult example, if that's all right. So prior to coming back as the clinical director of Out Youth, I worked in community mental health, which was an amazing experience in a lot of different ways. And I definitely worked with several trans-identified adults. There were folks who, for a variety of reasons, because of some structural factors, the client I'm thinking of in particular had been incarcerated for a good amount of her adulthood. And we could talk a lot about, I think, how certain populations of intersectional identities, including race, ethnicity, including LGBT identities, may be targeted in certain ways. So that's one level of sort of structural consideration that I'm thinking about with this client. But specific to my work with her, hadn't legally changed her name, but, had a name that was her name. And so one thing that was hard and frustrating is that in our electronic management system, we didn't necessarily have the option to put the client's name in the official record because of billing to certain programs, et cetera. So one thing that I really fought for was saying, hey, I get that this is one thing that for a variety of reasons cannot be changed. However, when I write notes about this client, I'm using her name. So how are we going to do that? Like, let's figure out how that's going to look, because that's a way for, me to respect my client, even if she never sees my notes, which she probably won't. But for me, I want to respect her and her authentic identity. So it was easy as saying something like in the first line of every note I wrote for that client, I would say, client's birth name, who will hereafter be referred to as their name, da-da-da-da-da-da. And so I think just little things like that. And it's unfortunate that we have to make those hacks in our systems. But I think sometimes it's just necessary, and it requires, being creative. In terms of other systems and structures that can be challenging specifically for youth to navigate, I would say, we end up doing a decent amount of advocacy related to schools, which was one reason why expanding our school-based services were so important to us. And listen, I think a lot of administrators, a lot of teachers, are doing their best. I have a lot of respect for educators. I come from a family of educators, and I know there's just so many demands, particularly in public schools, particularly in under-resourced communities, because we've got, a lot of disparity when it comes to education, unfortunately, in this country. At the same time, I feel like it's become a little bit of a battleground, and it's hard for particularly, some of our trans-identified youth to navigate for a variety of reasons. And so that's one thing that we try and do some advocacy around. We chat with the kids about that. We chat a little bit about self-advocacy, and I do that with a lot of my clients. And not to get back to the individual, but I think it speaks to the structural piece that you're mentioning, is that I often, because I'm honest with my clients, I say to them, I'm like, this is the unfortunate truth, but I have to ask you to be a better self-advocate than somebody who is cis-identified and heterosexual. And that bums me out. And I'm sorry to place that upon you, but because of some of the structures and systems we have in place, that just may be the case. So let's talk about some skills where you can feel empowered. And short of that, what can we do to help you advocate within some of these systems that may not be treating you fairly or equally, or because you haven't yet legally changed your name, because that's a huge pain and takes a lot of different steps and a lot of resources. Let's talk about, how your teachers might be able to honor your name and your pronouns. So, when I think about youth in particular, not just to pick on the school system, because there's or schools in particular, because there's tons of other systems that impact their lives, obviously, but that's one that comes to mind that we have to intervene with fairly regularly.
I hope you enjoyed today's CLC podcast. If you have any questions on how to bring CLC initiatives into your local system of care community, please feel free to email us at info@txsystemofcare.org.